Welcome to DermTV Viewer Questions Week for October 2013. Today's episode will feature questions from DermTV YouTube viewers and DermTV.com viewers. Hello, I'm Dr. Neil Schultz, and welcome to DermTV. Today we're going to start with questions from YouTube viewers. The first question comes from Luna C. Hi Doc, can I use Rogaine foam on my lashes? Sure you can, and I would recommend using it twice a day. But don't forget, foams are not as easy to control as regular liquids, so you need to be very careful not to get it in your eyes. And I would expect to wait 1 to 2 months to start to see results. Next question comes from Getting Nailed. I'm going to have some broken capillaries around my ankles and on my feet treated, and I've had my larger veins treated through laser and then injections. I'm being told the smaller capillaries, the spider veins, can be treated with injections too. To me, it makes sense doing it with lasers as you suggest, as they are quite small and there are many. Getting Nailed? I actually didn't suggest that. I suggested lasers for facial spider veins, not for leg or body spider veins, and I'll explain in a minute. And they go on to ask, what kind of lasers are you talking about? Well, so I really wasn't talking about lasers for the spider veins on your legs or on your chest or back, because those veins are much deeper. And deeper veins require more powerful lasers that have trouble penetrating to the level of those veins. So actually, in my practice, I treat all leg spider veins with the injections. I think they work better, faster. They're absolutely painless and a much faster recovery. So I'm not a big fan of using lasers for spider veins on the legs. Holidays Love asks, Hi Doc, as you explained in your video, I do the same. I go to the gym after workout, so I clean my makeup with makeup remover and splash with water. If I don't moisturize, then during exercise, my face will feel dry. So I put a light gel moisturizer on. Is that okay? Does it block my pores during workout? A gel moisturizer is probably not going to block your pores, and if you're getting too dry during your workout, using a light gel moisturizer would probably be okay. Just make sure that you're not getting clogged. If you want to test it, it's real simple. For your next few workouts, just apply your moisturizer to one half of your face and see if there's any difference in the breakouts between the two different sides. Then Candy Floss 86 2010 asks, can I use baby wipes? It's easy to carry in terms of wiping your face before exercise. And Candy Floss, that's a great idea. They are very convenient. So they will help get your face cleaned up, but they won't do anything to get the dead cells off the way a chemical, and particularly a glycolic exfoliant will. Paralumen Funtanilla asks, Hi Dr. Schultz, what's the difference between taking vitamin C and putting vitamin C on the skin, and how does vitamin C help acne? Putting vitamin C on the skin allows the chemical to penetrate directly into the skin, so you have a very good chance of getting a high level or a therapeutic level in the skin. When you take vitamin C by mouth, like anything else, you have to take enough for it to diffuse throughout your system, be absorbed into your stomach, then go into the bloodstream. And by the time it gets diluted in your entire bloodstream and in your entire water compartment in your body, because vitamin C is water soluble, is often water soluble, you just don't get very high levels in your skin. And it would be kind of tough to take enough to get enough in your skin. So I am a much bigger fan of using topical vitamin C for an antioxidant than oral vitamin C for skin, although for the rest of your system, of course, C is a great antioxidant. And in terms of how does it help acne, I'm not really aware of vitamin C being really helpful for acne. Topical vitamin C can help with the brown discoloration after pimples, the post-inflammatory hyperpigmentation, but not with the actual acne breakouts. And last, Nisa 176. Doc, I'm a girl and I want to know if it's okay to use men's face wash. Good question. Will it give me any bad effects in the long run? Some websites say that every face wash is the same, but other websites suggest that women shouldn't use men's face wash. The thing is, I've tried my brother's face wash, and I think it works well on my skin. Nisa, I have my own skincare line, but I don't have separate face washes for men and women. I think it is perfectly fine to use, for a woman to use a man's face wash and vice versa. The thing that you want to be most specific about, though, is making sure it's an oil and water skin type appropriate face wash. So if you're using your brother's face wash and you're getting good results, carry on and good luck. So let's take some questions from DermTV viewers. This is by Shannon, and she asks, are cosmetic lasers good on all skin types and tones? Shannon, it depends on which laser you're talking about. So if you're talking about a laser for hair removal, you just have to make sure that regardless of how dark the skin tone is, that the actual color of the hair is darker than the skin. When we're talking about lasers for removing broken capillaries, then it doesn't matter what color skin type you have. If you're talking about removing tattoos, that can get a little tricky with darker skin types, particularly type 5, which is Hispanic, Asian, and Indian, or type 6, which is African American. So sometimes with removing different color tattoos with lasers in African Americans can leave white marks. So it really depends on what's the purpose of the lasering and what laser is being used. So obviously you want to go to a competent cosmetic laser surgeon who will know which lasers he or she can use for your problem with respect to your skin type. This is from Shalise, and it's the last question for today. I used to suffer from a skin picking disorder called dermatillonmania, and for the most part, this condition has a habitual spot that they pick. I think what she's trying to say is that people who have this condition repeatedly pick at the same spot. Unfortunately, my habit spot used to be on my breast, and now I have severe hypertrophic scarring. Some are dark brown because of extra pigment, others healed white, which means she picked so deep that she actually lost her pigment. So she's got too much pigment, not enough pigment, and raised hypertrophic scars. What kind of treatment regimen, if any, can I use on this area to not only flatten, but shrink or meld the discoloration? Well, first of all, for the dark hyperpigmentation, we would use the same routine we use for all types of hyperpigmentation, which is very strict sun protection, which is probably not going to be an issue unless it's on a very high part of your breast. Number 2, a glycolic exfoliant to take off extra layers of dead cells that have too much pigment that's accumulated, and a bleach to stop additional pigment formation. For the white areas where you've lost your pigment, you've lost your melanocytes, no topical treatment is going to be able to restore that. There are some lasers called the excimer laser, which can stimulate even white areas without pigment cells to make new pigment, but of course you're going to need to see a dermatologist for that. And last, for the raised part, there are lots of over-the-counter, mostly silicone-based patches and liquids that can be used to try to lower the raised scars. Cortisone, topical over-the-counter cortisone probably is not going to be strong enough, so for topical cortisone or cortisone injections, you're going to need to see a dermatologist. So that's it for this month's Viewer Questions Week. And don't forget, the subjects from so many DermTV episodes come from your questions, which are so great. So please keep sending them in. Please join me again at dermtv.com. If you have a question, please send it to me by visiting dermtv.com/question. I'm Dr. Neil Schultz, and thank you for watching today.